Let's go.
Kau tak nak share ke account kau ni?
Boleh je nak share. Sabar je.
Walaupun aku takkan tengok, tapi aku nak untuk memori. Mana tahu tengah nanti rindu tengah lecture.
Dah. Ada. Memang seorang memang akan ada punya sebab aku dengar kau cakap pasal kau dalam video je.
Sumpah ada lecture aku tak boleh cakap. Just nak tunjuk.
Ni yang mana je? Oh, okey betul.
Benda ni unlimited kan?
Ha?
Unlimited kan?
Ha.
Apa unlimited?
Yang penting kau kena buka dekat public.
Apa
Bukan
unlimited?
public.
Ha. Yalah.
Storage.
Ya, storage. Google punya storage. Macam kalau YouTube ke apa kan dia unlimited.
Ha.
Itulah cara dia. Mana? Bukan. Itulah.
Okay, welcome back.
Yes.
Boleh start eh?
Boleh.
Okay, so now the first part of the sex, which is male. I will continue with the everything about male reproductive organ in detail. Okay, so able to describe the gross anatomy of the principal structure and applied anatomy male reproductive system. It can there's a lot of how you want to divide the male reproductive system. Okay, external genitalia, which is penis, testis and scrotum. Okay, internal genitalia, including all the accessory glands such as minor vesicle, bulboureteral gland, prostate gland, the ductus deferens and ejaculatory duct. Okay, this is duct system. However, one of the duct system we call epididymis is grouped under the external genitalia. Okay. So we start with the penis first. Okay, it's a male copulatory organ and common outlet for urine. Okay, and semen as well. It has root, okay, the body, and also the glands of penis. Okay, and it made up of 3 erectile tissue, which is the corpora, 2 corpora cavernosa, and 1 corpus spongiosum. Okay, so you know the root, the crura, and also the bulk. Okay, so the body is all the muscles, and this is the glands of penis. The root of penis, okay, so I mentioned it's the most proximal and fixed part of the penis, located in the superficial to deep, superficial perineal pouch. Is composed of the 3 erectile tissue, which are 3 crura and 1 bulk. Okay, 2 crura of the penis and 1 bulk of the penis, and 2 muscles, which is the ischio-cavernosus muscle and bulbous spongiosus muscle. Okay, so the crust of penis is located laterally, attached to the crust of penis is attached to the ischioramus and covered by the ischio-cavernosus muscle. Okay, bulk of penis located at the midline is covered by the bulbous spongiosus muscle. Okay, ini yang berada di superficial perineal pouch. So the body of penis, okay, is suspended from the pubic symphysis. This is the body of penis, suspended from the pubic symphysis, composed of 3 cylinder erectile tissue, which is 2 corpora cavernosa and 1 corpus spongiosum. Okay, corpora cavernosa dekat lateral side, located at dorsal, not ventral, dorsal, dari atas, fused with each other in the median plane and diverge proximally. Okay, it will diverge proximally here, forming 2 crura. Okay, and fixed to the pubic arch. Corpus spongiosum, okay, located ventrally, dari bawah, and it traverses by urethra. Okay, urethra traverses in the spongiosum, not cavernosa. Okay, and distal end is expand. Distal end of the corpus spongiosum extend to form glands of penis. And also, okay. And also the proximal end form is bulb. The proximal end form the bulb of penis. Okay, and is fixed to the perineal membrane and pubic arch. Okay, so the proximal end itulah yang ada bulb of penis, crust of penis. This is formula. Okay, glans of penis is a distal expansion of the corpus spongiosum. Is conical in shape. The rounded base of glands, we call it the corona of glands. Separate the glands from the body of the penis. It's contain the glands of penis also contains the external urethral sphincter. Okay, so glands and ada corona and ada external urethral orifice of sphincter, external urethral orifice. Okay. So what are the covering of the penis? Okay, dari luar, skin. This is skin, tightly and highly elastic and devoid of the appendages, devoid of the gland lah. Except the preputial glands located at the base of the corona, base of the corona. Okay, then superficialis fascia, devoid fat and consists of loose connective tissue interspersed by ductose fibers, and then buccal fascia, deeper. Denser facial sheets with envelope both corpora cavernosa and split to envelope the corpus spongiosum. Okay, yeah, the buccal fascia. Okay, this one. They cover both corpus cavernosa and corpus spongiosum. And last not least, tunica albuginea, the deeper, covering all three corporal bodies as well. Okay, so about the foreskin, a double layer. This is a double layer of the skin and fascia and covers loosely over the glands of penis. Okay, there is no hair and fat in the prepuce or foreskin and connected to the surface of the glands by frenulum. Okay, lidah pun ada frenulum. Okay, glands of penis also present of the frenulum. Jangan confuse. Okay, so it's a median fold of skin or ventral surface of penis. Okay, then only present the ventral surface and not dorsal surface. So what are the ligaments that present in penis? Okay, suspensory ligament, condensation of the deep fascia, thick fibroelastic band and fixed to the pubic symphysis. Fundiform ligament here, condensation of abdominal subcutaneous tissue, run down from linea alba. I hope you remember the linea alba. Okay, form a sling of penis and attach to the symphysis pubis. Ada sling yang jaga penis you all. Okay, we call it fundiform ligament. Alright, so it's present attached from the linea alba. Okay, so what are the arterial supply of the penis? Dorsal artery, all dorsal artery. Okay, is supply the corpus spongiosum and spongiurethra. Deep artery supply the corpus cavernosum and also the bulbourethral artery supply the bulb, the urethra, the corpus spongiosum, and the glands of penis. Okay, all are branches from the internal pudendal artery. We travel in the Fox canal. Venous drainage of penis, deep dorsal vein. Here, this is deep dorsal vein. Is single and in median plane, drains into prostatic venous plexus, has companion dorsal artery and nerve and also vessel and vessel. Superficial dorsal vein, single in median plane as well, no companion artery on or nerve, and drains spontaneous plexus and prepuce area. Okay, so two veins, deep dorsal vein and superficial dorsal vein. Innervation of penis. Okay, dorsal nerve of penis is branch of the pudendal nerve, sensory and innervate sensory glands of penis. And cavernous nerve of penis, sympathetic and also parasympathetic. Okay, sympathetic for thoracolumbar, parasympathetic sacral component. Okay, sympathetic for vasoconstriction, contraction of seminal glands, prostate and seminal fluid emission. Okay, the emission is sympathetic. Okay, for the erection, you need the parasympathetic for the vasodilatation. Lymphatic drainage, skin to the medial group of superficial inguinal lymph node, okay, and then glands of penis, deep inguinal and external iliac, and erectile tissue and sponging urethra, internal iliac lymph node, private iliac cell. Okay, now this is about the erection of the penis. Okay, is initiated by sexual stimulation and relaxation of the smooth muscle of corpora cavernosa. Okay, the corpora cavernosa, the smooth muscle, it need to be relaxed and it need the parasympathetic, not sympathetic or not somatic. Okay, for the erection only by the parasympathetic, and it repeat and is subsequently influx of the blood filling the cavernous space leading to pinna to vessel, become engorgement. Okay, this one dilate, engorge. Okay, engorgement, and then it after pinna to vessel and engorgement, it obstruct or compress the emissary vein, preventing the venous outflow or veno-occlusive mechanism to sustain the erection. Okay, so this is a 3-step for the erection.
Nanti kita
For emission and ejaculation, okay, emission is a transmission of seminal fluid from the vas deferens, prostate, seminal glands into the prostatic urethra. Okay, sampai ke all the seminal fluid until the prostatic urethra, we call it emission. So it needs the sympathetic control, not parasympathetic, not somatic. Okay, now that's emission. Then proceed with the ejaculation. It needs all sympathetic, parasympathetic, and somatic. Okay, so expulsion of the seminal fluids from the prostatic urethra to the exterior. Okay, why it needs somatic? Because it needs contraction of the bulbous condylosus muscle. Okay, it's about 6 times of contraction. You guys boleh control kan? Okay, so it's average 6 times. Tak tahulah berapa banyak So that's average about 6 times to control for the that muscle for the ejaculation. Okay, then please somatic control. And then it needs the closure of the neck of the urinary bladder. Okay, so the closure neck of the urinary bladder, okay, is need the sympathetic, and relaxation of the external urethral sphincter is need the parasympathetic. So this is the summary of the erection, emission, and ejaculation. Okay, a bit of the applied anatomy. So if let's say we call it erectile dysfunction, means inability to achieve to listen despite adequate sexual stimulation, and priapism is due to prolonged erection that fail to subside after ejaculation. It might be drugs, right? Drugs involved. Okay, so this emergency, if untreated, we can call it ischemia of the penile tissue. Okay, so it need to be irreversible, and it need to drain the blood outside. Right? Now we go to the testis. It's a firm, ovoid, mobile organ, about 4 to 5 cm length, 2 to 3 cm breadth, and 3 to 5 cm diameter. Okay, so it's suspended in the scrotum. Okay, testis tu suspended kat dalam scrotum kat luar by the spermatic cord. Okay, this is spermatic cord, and left testis is usually more inferior. Okay, there's a lot of reason, but usually the left testis is more inferior as compared to the right testis, and it needs to control the temperature 3 to 5 degrees below the body temperature. So how is controlled? Because it's inside the scrotum, characterized by the scrotal skin, counter current heat exchange. Okay, it's all the factors that contribute the lower temperature of the testis as compared to the body temperature. So the function of production of the sperm and also the endocrine hormones. So these are the covering of the testis. Okay. Very luar Okay. So to recap, vaginalis, paling luar parietal, okay, adjacent to the spermatic fascia, and visceral layer, set covering posteriorly at epididymis, They're covering all part of the testis except at the epididymis area. Small amounts of clear straw-colored fluid in the cavity allowing the movement of the testis. Maksudnya between the parietal and visceral ada small amount of fluids. And then intermediate tunica albuginea, okay, is collagen fibers extend and septa of the testis, okay, and mediastinum that present also mediastinum of testis. So this is in okay, dari septa tadi, okay, septa. This septa testis is formed by the tunica albuginea, not vaginalis or not musculosa. The septa is formed by the tunica albuginea, and mediastinum testis also. This incomplete, this is area of the incomplete fibrous septum posteriorly, okay, which are all the neurovascular structure traverse here. And in the most tunica vasculosa is covering the blood vessel and is a loose connective tissue, covering the blood vessel. Okay, blood supply of the testis comes from the testicular artery. Majority of it comes from the testicular artery. Testicular artery is a gonadal artery. It's derived from the abdominal aorta and is sent through the spermatic cord. And we also receive the blood supply from the premenstrual artery and also artery to vas, different, or artery to ductus different. So, but the majority from the testicular artery, about 2/3 of the supply. Okay, the venous drainage, pampaniform plexus, okay, is a venous plexus of testis and epididymis at the posterior border of the testis, and it becomes the testicular vein, which is the testicular vein present or valve at the ring of the deep inguinal ring. Maksudnya kat deep inguinal ring tu akan jadi testicular vein, itu kan nama. Okay, and it also form the thermoregulatory system to make sure the testis is degree below as a normal body temperature. And left testicular vein drain into left renal vein, and right testicular vein direct drain to the IVC. Dah belajar urinary. Okay, so the lymphatic, the innervation from the 7 to 11 thoracic segment or inferior progressive plexus able to cross over between testis, left and right. It can cross over. And lymphatic drainage to the lateral aortic, and also lateral aortic here, and also both left and right testis. This one, lateral aortic, left and right. So about hydrocele, it's common in children. Okay, so it's the increased volume in potential space between parietal and visceral layer. Tadi kan ada layer kan, visceral and parietal layer. Kalau increased volume, we call it hydrocele. Okay, to become vaginous. Due to obstruction, it might be due to obstruction of lymphatic drainage, inflammatory, traumatic, or neoplastic condition of the testis. Okay? This is a few types of the hydrocele, non-communicating or communicating with the GI system. So how you want to perform this boy ada hydrocele or not, you have to perform the transillumination test. Okay, shown with the torchlight, and you can see the obvious testis, water. Then scrotum. This is a scrotum that covering the testis. A fibromuscular cutaneous sac. Skin is thin, pigmented, devoid of fat, hair bearing. Okay, devoid of fat, hair bearing, and rich in sebaceous and sweat glands. Right and left scrotum is divided by a raphe. Scrotal raphe externally. Kalau internal kita panggil scrotal septum. Okay, dia sama ada kat luar atau dalam. Luar scrotal raphe and dalam scrotal septum. The scrotum contains spermatic cord, testis, and epididymis. Okay, and the dartos muscle, ada tak situ? Dartos muscle here, okay, help in regulating temperature of scrotum by wrinkling the skin. Okay, so it decreases surface area and reducing heat loss. Okay, so maksudnya kalau macam tempat panas kan, so dia akan wrinkling the skin to reduce the heat loss. Okay. So this is layer of the scrotum, skin, dartos muscle, external spermatic fascia, then cremastric muscle and fascia, and internal somatic fascia. You can ingat, there's a lot of layers covering the scrotum from the skin up to the internal somatic fascia. Okay, so these are the homologue of the skin covering testis and layers of anterior abdominal wall. Because kan skin of the testis juga akan naik atas, akan jadi skin layer of the anterior abdominal wall. So these are the homologues. Okay, skin. External oblique pterosis, okay, so somatic fascia. Internal oblique muscle must be cremastric muscle. Okay, so these are the homologues. Alright. So epididymis kat belakang dia, coma-shaped structure. This is epididymis. Lies always posterolateral of the testis. So you can identify this testis belong to the right and left. It can be based on the location of the epididymis. Epididymis always located posterolateral to the testis. Present, there's also sinus epididymis. Okay, thick groove laterally as testis epididymis boundary. Functions. This is the function of the epididymis, is storage of the sperm. The store the sperm. Okay. Okay, sinus epididymis dia macam boundaries between testis and epididymis. So it consists of head, body, and tail. Okay, head, body, and tail. Okay, head formed by 8 to 12 efferent-ductals or efferent of testis. Okay, and then body formed by heavily coiled duct of epididymis, where sperm undergo final stage of maturation. Okay, and tail continuous with convoluted portion of the vas deferens. Dia akan jadi vas deferens later. Okay, epididymal cysts arise from the epididymal tubules and present spermatocele. Cysts, they are basically aneurysm of the efferent ducts and it contains sperm. Okay, then ductus deferens or vas deferens after epididymis testis, epididymis, then akan jadi vas deferens. A straight thick muscular tube derived from mesonephric duct. Remember, is connect the epididymis and prostatic urethra via the ejaculatory duct. Okay, so sekarang nanti ada ejaculatory duct sebelum dia akan connect sebelum jadi so masuk ke prostatic urethra. It transport mature sperms. Okay, so the vas deferens always transport mature sperm. Sebab tadi proses mature tu berlaku di body of the epididymis. Okay, so dia transport dia sekarang. Got three anatomical part, the scrotal part, okay, the inguinal part, and also the pelvic part. Okay, yeah, this is inguinal part already. Okay, scrotal part. Ascend, okay, vas deferens ascend along posterior border of testis is tortuous. Okay, ingat the scrotal part of the vas deferens also tortuous. Bukan straight tubule, it's also tortuous. Dia macam lebih kurang epididymis. Okay, and the tortuous about 2 to 3 cm only. Lies on medial side of the epididymis. This is epididymis, lies on the medial side. Okay, and so it means the posteromedial to the testis. Okay, tadi epididymis posterolateral ke posteromedial? Posterolateral. So now vas deferens posteromedial to the testis. Okay, now inguinal part, curve along the lateral side of inferior epigastric artery and ascends for about 2.5 cm in front of the external iliac artery. Okay, and pelvic part, descend on medial side. What's different? Medial side of the pelvic side wall, cross superior to the ureter at the superolateral angle of the bladder, and reach the prostate posteriorly. Okay, the superior view, and tortuous and dilated also, and ends at the ejaculatory duct. Okay. So neurovascular supply artery to vas, vein prosthetic venous plexus, innervation inferior apophytic plexus, and lymphatic drainage external and internal iliac lymph node. Okay, vasectomy is a prominent and is one of the most effective methods. Spermatic cord. Okay, this is the spermatic cord. Begins at the deep inguinal ring. Okay, you dah belajar kan spermatic cord dalam elementary? Ha? Ada tak touch? Tak ada? Sikit lah. I'm not sure whether this is sikit or not. Okay, so it's begin at the deep inguinal ring and extend to the length of the inguinal canal and exists in the superficial inguinal ring. Okay, and it's anterior to the proximal tendon of the longest and the testis in the scrotum. Okay.
Comel. Oh ya ke?
Cuba fokus kat fitness ni je.
Aku pegang crutch.
Actually, I have another presentation at 12:15 dalam 15 minit. Boleh ke tunggu kejap? Okay, kita sambung balik
Sempat ni.
Thank you.
Sempatnya ke sempat?
Boleh 50 je.